The Rajasthan government has passed a right to health bill, but not everyone is happy. So what exactly does this bill provide for, and why are doctors up in arms? Basically, the Right to Health Bill gives every resident of the state the right to avail free outpatient department services and inpatient department services at all public health facilities and select private ones. The key here is private. On the face of it, the bill seems to be a revolutionary step, with anyone being able to walk into any private facility and avail any treatment that is required without having to pay the money up front. No private hospital or doctor will be able to deny treatment even if you don't have the money. The bill requires such healthcare providers to raise bills later that the government will pay. However, how wide-ranging the bill will be, what diseases or what procedures that will be covered, will depend upon the rules that will be framed after the bill becomes the law. So, the government could include limited number of diseases and select surgeries and tests for inclusion in the bill, or it could widen the scope of the bill to include most diseases and surgeries. But remember, the government would have to foot the bill eventually, which will make it costly for it. So the general idea is that only a limited number of diseases and procedures would be included. In the bill, free healthcare services means consultation, prescribed medicines, diagnostics, and any surgery or emergency care that may be required. As per the bill, even in medico-legal cases, meaning an injury related to crime, the hospital or doctor can't delay treatment on grounds of police clearance. The bill also provides for emergency treatment for accident cases and snake and animal bites. The bill has a total of 20 rights prescribed for the patients. The bill has provision for punishment for doctors and healthcare providers violating the provisions of the Right to Health Bill. Violators will be liable to pay Rs 10,000 as fine for the first time and Rs 25,000 for the second violation. So, on the face of it, the bill seems all fine. Nobody is denied treatment, and if the person is too poor to pay, the government steps in and reimburses the doctor or the hospital. But, as we know, there is widespread opposition to the bill, especially by the private hospitals, doctors, healthcare professionals, and support staff. Here is what the opponents of the bill have to say. One main objection to the bill is that the state government already has its flagship Chiranjeevi Health Insurance Scheme on the lines of Government of India's Ayushman scheme, where free treatment of up to Rs 10 lakh is provided for the poor. There is also a Rajasthan government health scheme for government staffers and another Nishulk Nirogi Rajasthan scheme that offers free treatment and medicines for the poor. So, critics ask, why is there a need for any other bill or law for healthcare? The government, on the other hand, says that especially private hospitals create hindrances in implementation of the Chiranjeevi scheme, resulting in difficulties for the poor. Here is what the Rajasthan Health Minister had to say on the need for the Right to Health Bill. Opponents also say that only multi-speciality hospitals with over 50 beds be included in the bill. Health professionals have also demanded that there should be only one forum for filing complaints against the doctors. What doctors say is that even at present, there are several places where complaints can be filed against them, including Medical Council, Consumer Courts, the Police, and the Human Rights Council as well. This bill, they say, will only add to the problems by making one more forum available for complaints. Doctors also feel that the bill may end up forcing them to treat patients outside their specialities. For example, if an accident victim reaches an eye hospital, how can eye specialists be expected to provide emergency care? The government, however, says that this will be taken care of while framing the rules. But doctors remain unconvinced. Providing reliable and affordable or free healthcare is an important part of any modern society. However, the key issue here will be implementation, as financial considerations are required. While the step may be a bold one, but its implementation will be keenly watched. That's all for now. Keep watching Times of India.